Hello, welcome everybody to another Holistic Vet Sisters. So we're back again, 6 p.m. Thursday. So apologies we weren't with you last week. Had lots of exciting things happening. Had the Dog Risk Conference in Finland, which I was involved with. And Dr. Lise was, your son got married, didn't he?
We
So
had a
that's
little wedding in
very
my house. Yeah.
exciting. Yeah. So there were very good reasons anyway. But we're back here and we've seen all your questions and we're very keen to support you today. And excitingly, today we're with Dr. Katie Kangas, and Dr. Katie is over in San Diego. Some of you may have seen her pop up before on a few platforms. Dr. Katie is an integrative vet and she really likes to work with functional medicine, which in a moment she's going to tell us a little bit more about. And also excitingly, it's the day for excitement, I think, Dr. Katie works predominantly online. So, I think you need to tell us more about what it is you do and who it is that you're serving.
Thank you. Thank you for that intro. I love that. And I can speak to that right away. Yeah, my practice has really morphed into, all in-clinic presence years ago before, the pandemic, of course. And that really led the way for a lot more telemedicine to be sought after in veterinary and human medicine, of course. And that's really how my practice has evolved now to the point where about 80% of my time is spent on telemedicine, whether that's online or on phone consult. And about 20% of my time is still in the clinic with my local clients. But the beautiful thing about telemedicine, obviously, is that I can support people around the country and around the globe. And I do have several, obviously, with, so much social media and amazing podcasts and how connected we're all getting globally now. It's such a wonderful thing that I can, serve people in the UK and around the world. And I have several international clients. So yeah, I love to do that. And what I really focus on, again, like you said, functional medicine, is being holistic. And by the way, my background, I'm Chinese medicine trained. I do acupuncture. I branched out into doing, a lot of obviously nutritional work, herbal medicine. I do chiropractic and in-clinic laser and all these things that most integrative practitioners utilize. But I've really come to focus on a niche that is called functional medicine in both the human and veterinary now. And, a lot of people, even Dr. Karen Becker, talk about functional medicine. And functional medicine is definitely a big umbrella of things we can use. But in a nutshell, the way I really like to describe it to people is that it really takes a focus on supporting the body to function at its best, because we all know that that our bodies are and our pets' bodies are brilliant, innate, structures and beings. And, oftentimes it's our, things around us and our planet and our diet and everything that are just getting in the way of our bodies functioning well. And so back to the modern times of how do we support the body to do that is just finding the tools that help the body to work at its best, which obviously diet and nutrition is top on that list. And there's other things that can be brought in. And then another part of functional medicine is looking at removing or avoiding the things that are breaking the body down or causing degeneration and chronic inflammation. And so I love to tell people, if you go to an integrative doc or a naturopath for yourself, for a human, some of the first few things they want to do is they want to test you for deficiencies and see what you don't have that you really need. What are you missing that's so important to you? Obviously, they're going to talk about a proper diet and all that. But secondly, they also want to test for toxins. And, what are you exposed to? What is your body accumulating that's causing problems? So that's kind of a nutshell of functional medicine. And that's, really my main approach. And so I do a lot of blood testing, which a lot of integrative people do, of course, and even hair tissue mineral analysis and stuff like that. But I love to make wellness plans for my patients that are very customized. That would include obviously supplements, diet, but lifestyle and other recommendations. So yeah, that's what I do.
It's a lot. This is like a jam-packed online consult you'll get if you work with Dr. Kate.
Can you just, before we get into questions, I know Caroline's got loads of questions today and we will cover as many as we possibly can. I just want to ask, while I still can, or I was going to say almost, just very briefly, your journey into this. I mean, when you were at vet school, were you interested in holistic medicine, or how did it happen for you?
Thank you, Lisa. It's always fun because it's such a different story for everyone. And
Um,
when I first went to, and I've been, I think, what is it, 1993, so 32 years. Holy cow. Yeah. So I've graduated 32 years ago. Isn't that
That's a
amazing?
good year. That's me
Um,
too.
and right. And so when I went through vet school, holistic was not, even in my radar yet. But within 10 years into veterinary medicine, maybe even a little bit before that, just in my own lifestyle, I started getting more interest in, holistic health and natural health. So I started seeking it out, but didn't really find anybody at that time. Now there's so many more resources available, until my own dog, who was 14 at the time, started really struggling with hind end weakness from lumbosacral issues and lower back issues. And there just wasn't a lot of good you know options for her to address that in Western medicine. And so I'd been interested in it for a while, but that really pushed me to really make the effort to find solutions for her. And that's when I found a veterinarian who did acupuncture and nutrition, and I went off to acupuncture certification at the Chi Institute in Florida. And so my girl's name, she was a black lab mix, her name was Asti. And she's, her legacy, one of many, was pointing me towards what I do now. So that was my beautiful entry. And from acupuncture, then I branched out into all these other awesome, modalities within holistic realm.
Yeah, I guess once you have that realization, you do become like a sponge. You're just like, oh my goodness, how did I not see this before? And it's just the door is opened. It's
Mm.
amazing. The
Yep.
tools
Yep.
you now have in your toolbox,
It's
Mm.
true. Well said. Well said. And to add to just one tidbit to that story, I thought my doggie was going to need to transition shortly after, I went seeking for these alternatives. And she lived almost another 2 years beyond what I thought she was going to have, with huge, quality of life. And that's, as I saw that unfold, I'm like, oh, I've got to do this. So that's when I dove in.
So with this, you've sort of built a name for yourself being interested in teeth and periodontal disease. How did that come about then?
Yes, when I opened my holistic practice or integrative practice several or a decade more ago, I leased space. I had friends and colleagues who were veterinary dentists in my region, and I moved into they had a really large facility with extra space, and so I moved into their space as a specialty hospital to lease space for my integrative service, because initially it was just me. And it was a tremendous relationship with them, and I had no idea that I was going to end up learning so much about dentistry along the way. And learned so much by proxy, just being there and speaking with them all the time. But as it turned out, some of the practice owner, and they're big researchers and also speakers and teachers and writing books and textbooks for veterinarians, and they're like, hey, you are kind of, you're not a boarded dentist, so you're our audience, a general practitioner, will you read our books and edit them so that we know they're making sense to other veterinarians? And I edited several textbooks and learned a ton that way. And then I got recruited to teach in some of their weekend seminars or wet labs when they needed another instructor, and they're like, hey, so they trained me to do some specific things. Not that I do the level of board certified dentistry surgery, and never have. And I haven't done any surgery, honestly, for a decade, because after leaving general practice and opening my practice, now surgery is not something that I do anymore at all. But that's how things kind of unfolded with me learning about dentistry and getting such an in-depth, and I've been to so many lectures, like so many dental lectures from all of these experts. And I found that with my patients in an integrative setting, I had become a better veterinarian because I understood dental health and oral health, because it impacts whole body health 24/7. Like, it is such a hidden source of chronic inflammation and, disease and degeneration. And I found that a lot of general practitioners, not no offense to them, but we're under, at least traditionally, and things are changing a bit, but we're under taught in veterinary school about dentistry. There's very, limited sort of surface level knowledge that we get compared to a human dentist. Obviously, they go to years and years of school just for oral health. And so I found that I was finding things and helping these pets to achieve better health with oral related things that their general practitioner, their primary vet wasn't finding. And I'm like, wow, here I'm a holistic vet and I'm actually, trained well enough in dentistry that I can be an asset for these pets and these pet parents with finding things. And so it was very rewarding. And so just jazzed up my passion about it. And then I started speaking and teaching, and it's just grown to be a thing for me now.
Mm. Do you know what? It's interesting because as you speak, it's sort of coming to my mind that generally speaking, especially being in nutrition, we sort of say everything starts in the gut. But then we say, but don't forget the mouth's an extension of the gut. So I'm beginning to wonder how much of it actually is starting in the mouth.
And that's such a great question, Carolyn. And it's shared, it's super bi-directional. So it's kind of, very involved there. But you are right. There is a lot between those two, whether, it's the chicken or the egg, but they're both so involved you can't really separate too much. But and being functional medicine, I am so about gut health too. I mean, I'm right there with you. That is a cornerstone foundation of always has to be addressed with any chronic health issue, of course.
You were just before we went live, we were talking about we don't have to go too much into this, but sort of root canals, and I remember this amazing film from many years ago, I think it's like 2008 2009, called Root Cause. I think I mentioned it to you when we had a chat once before, and it's about how when people have root canals and they leave the periodontal ligament in, even, or they just do the root, so they may take the tooth out but leave the periodontal ligament in and it seals and there's still an infection above, or they may leave the tooth in and seal it but there's still an infection above. And this program was showing just how many ailments in humans, of course, were related to this. And
yes,
I wondered, because Lise, you mentioned about root canals, didn't you, before? So I don't know, like whether there's something going on with dogs there as well that's bigger than what we're really even understanding with teeth.
yeah, such a great and in-depth question. And so many obviously holistic and integrative mindset people are very concerned. And even, and I have a biologic dentist, a holistic dentist, and have been seeing a holistic dentist for years. And one of the biggest questions they get all the time is people come in and say, is a root canal bad for my health? Should I not do that? And there are holistic dentists and even endodontists in my area that have a more holistic focus, for being an endodontist. And an endodontist, of course, is, a dentist who is trained specifically to do root canals and endodontic work. So it's very specialized above typical dentistry. But there is, obviously a lot of concern around having a root canal tooth in a mouth. And that is all true what you said, of course, Caroline, that these things, that root canals can definitely be a source of issue and continued infection and things like that. So there are a lot of people a lot of holistic people that would advocate for just removing that tooth and, extracting it versus having a root canal. The board certified dentists, veterinary dentists that I have worked with, their line of thinking is that if it's done well in the hands of somebody who's very expertised, very conscientious, in doing that job, that a root canal is, in their opinion, of course, it is still a really good, viable treatment to consider. Now, that said, there are what dentists, board certified dentists, call 8 strategic teeth in the mouth of a dog. And so if somebody was leaning towards extracting a tooth, board certified dentists would be like, for all the other teeth other than those 8 teeth, those teeth are pretty expendable. Like, you want to extract them? We can extract them. If people really want to save the teeth, of course, they'll help to save the teeth. according to, my understanding from most dentists, they really would like to save 8 particular teeth in the mouth because they provide such strength to the jaw structure and function to the dog's mouth. And we know dogs can live without teeth. I mean, there's a lot of dogs and cats that don't have any teeth left. And so sure, they can live a totally good quality life. But if we want to help retain, function, then the 8 teeth that are really important to them are the 4 canine teeth, which of course are the fang teeth, I tell, for clients. And then the upper 4th premolar, which is the 3rd rooted tooth, that's often called the carnassial tooth, up here. And then the lower 1st molar, which is 2 rooted, but it's enormous tooth. And so those 8 teeth, so 2 here, and then the 4 canine teeth, if someone was considering a root canal, those would be the teeth that you would want to think more deeply about, what treatment plan you really want to do. So, and then the other thing I could speak to is in human medicine, to kind of get to what you were talking about, Caroline, with that, documentary and just all the stuff that we know of, this can be such a problem, is that in the human dentistry, arena right now, in biologic dentistry or holistic dentistry, there's a lot of newer, treatment modalities or tools within the treatment to make this situation better. And so my biologic dentist, advertises and she's got all kinds of videos on her website and stuff about a biologic approach to a root canal. And, different materials are used and things like that. But importantly, the traditional way of doing a root canal was going in there with, instrumentation and rooting out the pulp cavity and all of that, and then adding in the sealers. And that's what we're concerned about, is sealing off infection. A lot of times it's not done, really optimally, where there are things left in there. Now they're using things like laser and something called gentle wave, which uses like sonic or sound waves to really get in there and get in all these tiny little grooves that you can't get in with an instrument and clean out that tooth. And then they're following with ozone for even more, natural disinfectant. And then they're sealing it up with more biocompatible materials. So now the unfortunate thing is, the veterinary dentists that I know, I've talked to them and said, is this happening yet in veterinary dentistry? And they're like, no, not yet. So, that method, these newer methods coming out are not really available in veterinary dentistry yet, as far as I know. Maybe there's pockets that it's happening, but people that I know aren't aware of it. But it is on the horizon, because that is coming into very into human holistic dentistry. I did talk to one of the board certified dentists I was messaging yesterday or earlier this week, and I was told that there's a lot of new research going on with stem cell therapy and all kinds of things for restorative and regenerative stuff in the mouth, but that's still really on the horizon. It's not even like really set into, human dentistry yet either, but there's some cool stuff coming.
Yeah, it's just taking a while to come across. Well, I suppose the thing is, we want to keep our teeth there, whereas animals don't mind so much, do they?
Well, that's exactly the point. I think, when is it functional and when is it just cosmetic? And when are we doing it for our animals where actually it's just cosmetic? And how do you, but I suppose your 8 teeth is a big part of that. For those 8 teeth, right, at least it's not cosmetic.
Right, exactly. Then it's functional. But that said, if the tooth is really abscessed and, there are a lot of circumstances where, of course, extraction is the best choice. And, veterinary dentists do, know the difference there, and they're going to support, hey, this tooth's just got to go. Like, your pet's going to be way healthier if this tooth is out of their mouth. So, if you have a good dentist, yes, they like to save teeth, but they're also very, realistic and knowledgeable about the best interest for the pet too. I mean, they should be. And, there are a lot of really great veterinary dentists. So when anything, honestly, for all of my clients, I like to recommend board certified dentists regardless. If they're going to have dental care for their pets, that is the best way to go. Is to someone who has that level of expertise. Because in general practice, there's just definitely varying levels of, training that people have. The other thing that I do like to say is with extractions in small breed dogs, like little bitty dogs, you know, under 10 pounds, I really like to encourage people to, you know, spend that extra money or go, you know, that extra effort to go to a board certified veterinary dentist for those extractions or that care, because pathologic fractures of the jaw, I don't know if you're familiar with those, in the mandible, is that little bitty dogs, that lower first molar especially, I mean, and they're, you know, they just have smaller jaw regardless, but that lower first molar can present a problem when it's really diseased and abscessed, because then some of the jawbone starts to, you know, erode away. And you know, when there's less jawbone there, that jaw is weaker, obviously, and when the practitioner goes to extract that tooth, the jaw can break. And even that can happen, you know, without a practitioner involved. I mean, you know, dogs are just, you know, they bump into something and their jaw breaks, and that's typically because of disease in the bone from, you know, chronic infection of those, you know, mandibular teeth. So but in little dogs, the root of that lower first molar, you know, proportionately to the jaw, it takes up a lot more, whereas in a large breed dog, it's not as big of a deal. So there are certain circumstances where you know, even extraction of teeth is just different, you know, amongst breeds and sizes of dogs, etc.
I think that's the thing, because we think of bone as being very solid, but actually it isn't. It's a living tissue that is actually quite easy to be infected or disturbed in that way.
Absolutely. And, you know, that's the big thing about periodontal disease. And, you know, I'd love to explain to people that the definition of periodontal is the deeper, you know, the deeper tissues, the deeper structures, you know, under the gum line. And when we have infection under the gum line in those periodontal tissues, then the bone starts, you know, we get bone loss. And the bone literally erodes away, and then you get a weakened structure. And obviously, if it's left undealt with, eventually the tooth exfoliates, which means it falls out. And that means there's enough bone loss that that tooth is so loose because the periodontal ligament can't hold it to anything, or that's eroded, etc. And boom, you know, the tooth pops out. But a lot of people don't know that when a tooth comes out, that literally means there's a lot of disease and a lot of infection going on under the gum line. So that's always a sign of, hey, we need to, you know, take care of this issue, even though the tooth's out.
What's the main advice you would give about dental health for someone with maybe with a puppy, or just sort of general advice that would apply to most dog owners or carers in terms of how do you tell people to maintain good oral health in their dogs?
I love it, Lisa. So great, because obviously being integrative and holistic, we always want to be proactive. So I love talking about that piece of it, proactive and preventative dental health. And so for puppies, I mean, well, definitely a big part of the conversation and equation is always species appropriate diet. You know, so, and I'm sure, you know, you have a lot of people who are raw feeders, and even if you're not, you know, raw feeding and you're doing, you know, mostly fresh food, at least species appropriate ingredients without a lot of carbs and starches and, you know, heavily processed food. All of that, of course, drives inflammation, drives bacterial load, drives different bacterial populations that are more pathogenic than, you know, the good guys, the friendly bugs. And so my conversation, Lisa, of course, for everyone is to talk about diet, species appropriate diet, but also other, you know, facets of oral health support, which would be, you know, proper things to chew, to do some, you know, active, you know, care on for the dog doing it themselves. And then us, you know, brushing the teeth as well, because mechanical cleaning of the teeth with the brush and wiping away the biofilm is, you know, one of the most impactful things. And so I like to tell people, yes, there are great things that we can put in the mouth, and I've even created a dental remedy, but the action of the brush, of a toothbrush, or something that's actively that they're chewing, that's rubbing up on the gum line, that is doing more. That little abrasive action is doing more than the ingredients in your toothpaste, because bacteria that sits on, that is in the mouth, is in what's called a biofilm. And a biofilm essentially is this gooey matrix of all these bacteria get together, and they're sort of stronger in a group. And that matrix, you can apply stuff that can be helpful, but applying something doesn't break up that biofilm as effectively as literally brushing it and mechanically wiping it away. So brushing is really good too. So I talk to people about that all the time. A soft toothbrush, you know, different dental products that we can use, or even gingival rubs, you know, if they can't brush, and you know, and the quality of the brush, or that the bristles have to be really soft, because we don't want to erode the enamel. A lot of people damage their enamel with excessive brushing and things like that. And the other thing I tell people is, with a puppy or anybody, go slow when you are introducing any dental care for them. In that, if you're going to brush their teeth, don't try and brush the whole mouth on the very first day, because the pet's generally not going to have a pleasant experience, and then it's going to be really difficult to continue that process. So I tell people, you know, maybe just touch, you know, and if there's something that they like on the toothbrush, but touch the toothbrush for a few moments and praise your dog, and, you know, really good, you know, treats or praise afterwards, and then go very slowly, like a few extra seconds per day. And it could take you weeks to do the whole mouth. And then that's great, because, you know, they let into it slowly, and it doesn't seem so scary and awful to them. So that's a nice thing too.
It's very much like nail clipping, isn't it? You can make it the highlight of the day. You just need to really decide to go that way and take the time to do it.
Yep.
Yeah,
absolutely.
there are a couple of the people in the questions. So Sarah, and forgive me if I'm saying your name wrong, Lone or Lona, they both use brushes, so they're very proactive, Sarah and this lady. So they're brushing, they're adding the plaque off. So they've got a plaque off product as well. And Sarah even mentions that her dog is eating chicken carcass as well, and hopefully stripping as well, because it's the stripping that's really key there as well. But they're both still seeing some brown coating. And Lona, sorry again if I'm saying your name wrong, she's also seeing some tartar. Now, one of the dogs is 3. I'm not sure about the other one, but they're both sort of wondering, you know, they're doing the proactive stuff. Should they be worrying about brown staining, brownness? Is this a worrying, or is that just going to happen anyway?
That is such a great question. So the cool thing to, you know, to really explain for everybody is that the bacterial plaque, actually, I think everyone's heard, you know, bacterial plaque is essentially that biofilm. And the bacterial plaque is kind of accumulating on the teeth all the time. Like even right after a dentistry, within a few days, you can find bacterial plaque right back on the teeth. So it's constantly accumulating. Once it's been sitting in the mouth for a while, a bit, then the minerals in the saliva and everything calcify the plaque, and then it turns into what we know as tartar. And so tartar, the visible brown stuff, is the calcified or hardened plaque. And so the interesting thing about tartar is, although it looks yucky, and you know, it truly is more of a cosmetic issue than anything else once it's tartar. Once it's calcified and sitting there. Now, you know, if it's up at the gum line and there's new bacterial plaque and all that, that's there too. I mean, that can kind of all be involved. But one of the things that I love to tell people, that's one of sort of the myths in veterinary dentistry, is that certainly pet parents often believe this, but there's still a lot of veterinarians that believe that the amount of tartar on the teeth is a good estimation or, you know, diagnostic factor of the level of dental disease for the pet. And that's actually not true. So the level of tartar on the teeth is different from, you know, the actual disease indicator is gingivitis, inflammation of the gums. And when I give presentations, I actually have slides that show really cool comparisons of, you can look at a dog or a cat's teeth, and they can be heavy tartar, heavy brown stuff, and there's like minimal to no inflammation at the gum line. And it's like, yeah, these teeth are kind of cosmetically ugly, but look at, there's at least at the gum line, what we can see, and granted, there can be things going on under the gum line that we can't see, but still, if you can't see a lot of inflammation, that's a good sign, you know? And so you can have pets with heavy tartar and minimal to no inflammation. And on the flip side, you can have a lot of inflammation and not that much tartar. So it's really nice for veterinarians and pet parents to understand that what we should really be looking at and looking for to best gauge our pet's dental health status is the level of inflammation. And with the gums, of course, they can get red and angry looking. They can get a little bit swollen. You can get like a red or purplish line at the gum line where the tooth meets the gum. Those are the, and if the gums start receding, I mean, that's, you know, then that's next level. Then we got some significant gingivitis going on. It happens for humans too, where the gum tissue starts to ride back and die back because it's been inflamed for so long. So those are the things we really want to look for. That said, I would love to add in this little tidbit, which is really good for everybody to know, that it is said that up to 60% of dental problems or dental pathology is below the gum line. So the thing that's good for everybody to know is when we veterinarians are evaluating the mouth and doing an oral exam in an awake pet, we may be only getting 40 to 50% of a perspective of what's going on. That's still really good. You know, if you don't see inflammation, that's amazing. But whether you see inflammation or not, there are things that are very likely going on under the gum line in a lot of, you know, a lot of cases that we can't see. And that's why dental x-ray and probing big time, to probe around the teeth to find out if there are deep pockets. And that's what's being done in a dentistry. So I love to tell people a standard teeth cleaning is very different from a full dental prophylaxis, because in a dental procedure, a big value of that procedure is not just cleaning the teeth. That's important, but it's the subgingival cleaning and it's the probing to find out, is there problems we don't know about that we need to deal with that are festering and causing health problems for the pet. So I love people to understand that difference of a cleaning versus a full dentistry.
I would love to hear your thoughts on this, because I often feel that there's a conflict. For me, it's a conflict between, you know, knowing that you can't examine and assess the mouth properly unless the animal is under anesthetic. But at the same time, I mean, I've met colleagues who want to do that to all animals, no matter what their mouths look like, twice a year. And to me, that's a lot of general anesthetics. And it's, how do you balance that? Have you got any thoughts on that?
Such a great question, Lisa. I mean, really, and there's, you know, that's one of those things where there's no right or wrong to that. I mean, that's such a gray area. And you talk to a veterinary dentist and they're going to say that they believe,
Weekly.
you know, they most of them would say for a larger pet yearly. Now I've had some of them say even every other year, depending on, you know, what they're seeing with the pet, or maybe they know the track record of that pet because they've done a few dentistries and they're like, you know, you're doing pretty good. Like maybe 2 years is okay. But a lot of dentists would probably say yearly, except for really small, tiny breeds. Then a lot of vet dentists would say ideally every 6 months, but every year still, you know, still amazing if, you know, people can do that. But, you know, obviously, Lisa, from the holistic standpoint too, you know, we're going to have a little bit different, you know, feeling and, you know, intention around that than a standard, you know, veterinarian or veterinary dentist. And so what I would say is, yeah, I don't, you know, necessarily advocate for always putting them under to look for everything when there's no evidence of anything, but I wouldn't be against it either. And if it was a small breed dog that had a history of issues, I'd be inclined to do it more often than not. But with the caveat, I tell people this all the time, the level of expertise that you're going with and the current standards of safety care for anesthesia cannot be understated. Like I always tell people, you know, don't shop for dental prices. Like if somebody's doing it for, you know, very, very low prices, there's probably a reason for that. And then if they're skipping safety steps or they don't have the level of training to know how to identify problems, then you're not getting any value out of that. They just went under anesthesia and took on a lot of, well, at least some potential risk, and they didn't get the value out of it. But what I love to tell people is if you're pet true, like if you have a small breed dog, like we'll pick a Yorkie, because I always joke around with people that Yorkies are a poster child of dental disease. But so we'll pick a Yorkie, and you know, the Yorkie has all this, I mean, clear dental disease, or they've had a really track record of, you know, having this issue, that if it's done well and anesthesia is, you know, really good, impeccable current standards, and you're with an expertised practitioner, that the risk of the anesthesia in that scenario is less than the risk of that severe periodontal disease affecting your dog's body 24 hours a day, because it is definitely, I mean, they talk, it's early mortality. It's not only kidney and heart and, you know, I mean, it's linked to IBD, it's linked to everything because it's just chronic inflammation. So that's where I sort of get to, a better assessment of judging, like, when is it truly worthy of putting them under anesthesia? Those teeny little dogs that have a lot of issues that you can clearly tell are going on, but the care quality that they're under is a huge part of that equation to make that better decision.
There's a lady called
Hopefully.
Deborah that asked if she should be worried about her dog having anesthesia for a dental because her dog's got collapsed trachea. Is this a worry then for an anesthetic?
That is such a good question. And just a caveat, I don't do surgery anymore since I've been, integrative focus. I haven't done surgery in a decade. But what I will say is that, of course, a lot of small breed dogs have collapsing trachea, and, large breed dogs can. And, some of them will have, other obviously airway issues. But I I know that a lot of dogs with collapsing trachea go under anesthesia, clearly very successfully. And even working with the veterinary dentist, I was never aware of the fact that collapsing trachea was a super big concern. And so I don't think it's been a really high risk factor, at least in most dogs. I mean, maybe it was a severe collapsing trachea, that'd be different because there's different, levels of condition. But for the standard collapsing trachea, a lot of dogs do really well with dentistry. But again, done well, good post-op recovery, monitoring. Some veterinary dental practices, at least in my region, also offer for any pets that are higher risk that might have some kidney issues or some heart issues or some airway issues. They actually offer for a board certified anesthesiologist to be present for the whole procedure. And then people pay a little extra, but they have, that peace of mind that you have a boarded anesthesiologist that is doing nothing but watching your pet for that whole time. So that can really elevate the level of safety, which is lovely. But in my experience or knowledge, brachiocephalics and collapsing trachea, yes, there's a little extra level of caution where you really want to monitor them well. But I mean, brachiocephalic breeds, again, they're poster children of dental disease, the Bostons and Frenchies and, anybody with pugs with short faces. I mean, they all have a lot of dental disease, and they have very successful dentistries that elevate their health all the time. So I wouldn't necessarily let just that factor stop me if I really knew my dog needed that dental care, but I would just be cautious about who's doing it.
I think that's such a good point. And I sometimes get the question, where can any question that starts with, where can I find a cheap whatever? I think it's just a dangerous question because do you really want that? Is that what you want?
Right. Yeah. And, you want to obviously be with a practitioner that you trust and that is not just there for the money. And that's a whole, different, end of the dynamic. But we definitely don't want to make the cost the most important thing if, clearly at all possible, because the quality is what everybody really wants.
And you want an expert at whatever it is that needs to be done. And if you want, dental work,
yes,
at any difficult, I mean, obviously depends what needs to be done and what the problem is. But I mean, I would say go to a vet who specializes in dentistry, like you say, and somebody who's an expert at that, and it's what they do all day long.
Yep.
Yeah,
and it's literally it's an invaluable difference because a lot of people just assume that every veterinarian has the same level of dentistry expertise or training, and that is really, really obviously not the case. So people don't know that there's any difference, and so it's really nice for people to gain that understanding.
So we've got a question from Claire. This is the other end, so of the scale. So the dog is 15.
I thought it was the other end of the dog. No, sorry.
Not the other end of the dog, sorry. Other end of the scale in terms of age, really. So 15 years. So dental work's risky due to their age. And Claire's wondering if there's anything more than just pain relief that she can offer for her dog.
For pain relief?
for teeth issues?
Yeah.
Is there anything more
dental
she
pain.
can do?
Does she say what
Yeah,
the problems
actually,
are?
She hasn't really. She's just said
Okay.
that,
okay, so dental disease. And my guess is there's probably really bad breath. There's probably obviously, visible gingivitis, and infection, inflammation. So one of the things that I would say is one of my favorite products, which I believe it's definitely available in some areas of the UK. But there is a dental additive that we brought up briefly on the Raw Pet Medics podcast that I was on too, but it's called Teeth. And Teeth is a prebiotic mix that is a water additive for dogs that they drink. And the wonderful thing about this product is that these natural prebiotics are supporting the good oral bacteria in the mouth, and they are suppressing by competing with the food, source of the bad bacteria. So it was developed by a human microbiologist to help to support the oral microbiome to its best. And it is phenomenal for everybody, but it's especially phenomenal for 15-year-old dogs that can't go under anesthesia, or people feel it's not right for them. And I've had multiple patients like that, where I've had clients say, I can't even barely be in the same room with my dog without gagging because their breath is so bad and they're panting, or they want to kiss me. And it's like, ugh, it's so bad, but I can't put them under anesthesia. They have, congestive heart failure, whatever's going on. And I have recommended this teeth product now for years. And within 1 week, people report back to me, oh my gosh, I can barely even sense my dog's breath. Like, this stuff is amazing. And I love to tell people that is such a great testament, because the bad odor is coming from the bad bacteria releasing those odors. So when the odor changed, that the bacterial composition in the mouth has changed, which is beautiful. And then wait that out a little bit and keep doing that product, and the inflammation starts to reside. And so the bacterial, and the thing with the teeth is it's put in the drinking water, so when the dog drinks it, sloshes around the mouth, helps get rid of the bad bacteria, goes below the gum line. So that's the other cool thing, is those ingredients actually work for bacteria below the gum line. And I love to tell people, still brush if you can brush, but when we brush, we can only get above the gum line, and at the gum line we can't get to down what's below that. And this teeth formula does that. And so it is helping. And then, of course, it's taking some bacterial load off the heart and the rest of the body, because it's just getting rid of those bad bacteria without attacking the good bacteria with antibiotics. So it's such a beautiful formula. And I mean, I'll just show, this is their old packaging, but just so people know.
Is this in the UK as well?
They said they had a UK distributor, and then that distributor fell through or whatever. So they're working on getting a new UK distributor to get it to you guys, but I know it's in a couple other countries in the EU. So, and this is the old packaging, but I love showing this to people because it talks about how it's supporting the good guys and blocking the bad guys.
I mean,
and again, it's a little powder.
It is what Ingenious Probiotics does, I think, as well. That's how that functions. So this is a spray that you can get in the UK.
Yes.
Did you say it was originally a human product? Sorry, I didn't mean to interrupt.
Yes.
Did you say it was a human product as well?
It is a human product. Yes. And you know what's cool, Lisa, is that when the human product first came out, and they've expanded and they have a couple other things in their product line now, but the human product originally, and still they have this version, is a little mint flavored tablet that you let dissolve in your mouth, and then it, spreads those prebiotics in there and such. But they were seeing such fantastic results with the drinkable version for dogs systemically, because then they swallow it after sloshes around the mouth, you swallow it. And I've actually seen two patients of mine with MRSA bladder infections, not a single antibiotic on the culture list, with every resistant. So people are like, well, what the heck am I going to do? And I put them on teeth because I've had many conversations with Dr. Emily Stein, the creator of this. And I put them on teeth. I've had two dogs whose MRSA bladder infections resolved after going on teeth. Like a month or two later, they were gone, which is quite impressive. So back to your great question, Lisa, they made a drinkable version for humans. And the other beautiful thing about this product is you can mix it in a water solution or even saline for ears, and you can apply it topically. And it is amazing for yeast on the skin as well. as bacteria because yeast love sugar, and the prebiotic ingredients in there, one of them is very notably competing with sugar. So any of the pathogenic bad guys and yeast and bacteria that love sugar go glom onto that, and they can't use it for food. They bind to it and they essentially die off and starve, which is beautiful. So they do have a human product. And for this 15-year-old dog, that is one of the things that I would employ for that doggy too. So
that's so interesting about the infections. That goes back to what I was saying, that maybe it starts in the mouth, really. And it's the mouth that determines the biome, the microbiome, that then determines
yeah,
what else is going on in the body.
right. Or so shared. And speaking of the microbiome, actually, I wanted to bring up another product that is very available to you guys, because I met Joe Flanagan earlier this year,
ingenious.
and his
Yeah.
ingenious probiotic products are amazing. And he's got the dental spray as well as several other products for skin and environment and eye, etc. But those are probiotics that are also competing, you know, with the bad guys and eating up the food sources. And so it's actually similar, but not as a water additive per se. But that's another thing that's very available to you guys. And I mean, you know, those could be combined or overlapped or whatever. So really great.
Okay, I've got one that maybe Lise can answer as well from a different point of view, but hopefully I say this right. Epulis, Epulis. Claire B
Yes,
is
it's little
asking
benign tumors, but little
like
benign growths of
yeah.
the gums. Yeah.
So
Yeah.
what do we think? You can both answer maybe from a slightly different perspective on this one.
So with epules, you know, interestingly, and this is just semantics, but what the veterinary dentists will say, and you know, in the textbooks and everything, is that the term epules is really a description of, you know, a swelling or a mass. It's not necessarily a diagnosis, although the largest ratio, I think, of epules are benign. So a lot of people just, you know, kind of think that term is just synonymous with a benign growth, but I think just semantics of terminology, not always benign. But point being is it can be like granuloma tissue, et cetera, et cetera. Normally, I mean, if there's multiple epules, I mean, I'd really be looking for like, what is the underlying reason of all this, you know, inflammation going on? And again, gut health and microbiome. And I, you know, really try to take an integrative, you know, systemic approach to that. Like, why is that happening? But when one, you know, just crops up or whatever, I will tell you that what veterinary dentists teach is that growths in the mouth should always be taken seriously, whether they look benign or not, because the percentage of malignant or more aggressive things in the mouth is just higher than on the skin. Like there's so many, and not every skin bump is, you know, fine and benign, but a lot of skin lumps are benign. And in the mouth, certainly things can be benign, but dentists say they get fooled all the time. They'll look at something and they're like, oh, that's probably benign, but we want to biopsy. We always want to they would like to biopsy everything in the mouth because a higher percentage of them can be aggressive. And a lot of dentists have been fooled where they expect it to be benign and it'll come back something really aggressive. And on the flip side, they're like, oh my God, that's so ugly. That's probably a super aggressive cancer, and it'll come back benign. And it's just massive reactive inflammation that came from something, you know, sometimes it's even a foreign body that's there and it's just caused all this stuff. So point being is in the mouth, it's, you know, we can be fooled. So it's really good to assess everything if possible.
Yeah, that's a very good point. Yeah.
Anything to add?
No, I think that's true. And I think any lumps in the mouth, you need them examined. Definitely, I would back that up. If they are benign, they're not a concern as such. But if you look more holistically and constitutionally at the problem, it would obviously be a pointer to something there that needs looking at. You know, why are they making these? Even if they're not a concern in themselves, why does this organism feel the need for this outlet? You know, what is it that they're asking for, so to speak? What is the imbalance?
I absolutely agree. And, you know, there's always a systemic component to that. And then in some cases, maybe there's a local component to that, you know, that there's just a lot of inflammation in here too.
And maybe even an emotional one as well, because this is the limbic center of the dog, you know, this is their emotional center. So there may be something going on there as well, energy wise.
Yeah.
So
I know a human dentist who works like that, who you know, depending on the tooth, where the different teeth represent different
yeah,
emotions and
yeah.
I was
different.
gonna say such a great comment, Lisa. I was gonna tell Caroline when she said that that was a brilliant comment about the energetics, because when we really get into the depth of, you know, biofields and energetics of everybody's body, we know that there's, you know, that every area of the body is aligned with, you know, certain energies or certain you know, emotions. And so that's key. But when I gave a presentation quite a while ago, maybe 7 or 8 years ago now, at the HVMA, I did 3 hours of lecture on integrative dentistry. Right after, one of my board certified dentist colleagues gave 3 hours from the conventional side, and then I gave 3 hours from the integrative side, which was really cool. And one of my 3 lectures, I went into the whole dental meridian and how each tooth can represent
Yeah.
different organ systems or areas of the body, and it was so cool. And then and you know, when you teach, you learn, and so I had to look, you know, look up all this stuff and delve into it. It was fascinating. And I also presented how, like in Chinese medicine, the stomach channel, and this goes back to Caroline's amazing comment, the stomach channel goes all around the mouth. And so all of these points, you know, in the stomach channel are not only very local to the mouth, but, you know, looking into the literature and finding that for, you know, instance, like stomach 44 or whatever, like on the foot, is known to treat dental abscesses and mouth pain and stuff like that. So you think about how connected that is on an energetic and meridian sort of alignment, and it's pretty fascinating.
So that's something the lady with the older dog could maybe think about as well, is different meridians that might be related to the teeth.
That's actually a great comment. Yeah, if there's actually dental pain. You know, and the other thing that we didn't go into, you know, with the, I mean, you know, there's all kinds of things you can do for, if she said pain, I felt like pain was in the question, but I might
Yeah,
be
yeah, it
wrong.
was. It was. Yeah.
Okay, yeah. So, you know, other natural things too, and certainly, you know, things like cannabinoids and, you know, natural plant medicine for pain, things like that, very good. You know what else I didn't bring up, which is a really cool thing, is, which maybe not as much for, well, it is for pain, but also for infection, is ozone. And, you know, ozone's used in biologic dentistry all the time in both, you know, veterinary and human, big time in human. And there are now ozonated oils that, because ozone is much more stable in an oil than if it's, you know, in saline or, you know, just as a gas. And you can rub ozonated oil on the gums. And ozone definitely is antimicrobial, and ozone is known to reduce pain too. So there's another topical thing. Then there are formulas that have clove oil in it. Now, clove is a strong oil, so when you're using it in pets or anybody, you have to make sure it's very diluted, etc. But clove oil is definitely known for dental pain. And that is sort of a nice segue for me to, you know, mention, there is not clove oil in mine, only because, again, you know, some people are like, oh, it's so strong. You know, I just wanted to make it appealing to the masses. But if clove oil is used appropriately, it's definitely a very good oil for dental care, especially dental pain, but dental infection also. But this is my Dr. Katie's remedy. I have a small line of homeopathics and my dental product, and I've just expanded the line actually. But my dental product is one of the first products that I released because, of course, I'm so passionate about dentistry. And it is a liquid that can be used as a gingival rub or on a toothbrush, or for humans, because it's very human worthy as well. I oil pull with it, you know, the Ayurvedic tradition of swishing the coconut oil around in your mouth. But this is organic coconut oil, actually from Cocoa Therapy brand. So it retains the lauric acid component in the liquid, in a liquid form, which is already naturally antimicrobial and anti-inflammatory, which is great. But I've added 3 ingredients and everything's organic, but essential oil of myrrh and essential oil of peppermint in, you know, very low concentrations so that it's agreeable to, you know, all pets. And then I also added trace minerals in a liquid form. And so minerals are really important in helping to remineralize the enamel, because our enamel weakens throughout life. And, you know, especially if, you know, we're, you know, brushing or pets are chewing and abrading the enamel, etc. But once enamel is formed, it's not reformed. It's never coming back. It just thins. But we can help to remineralize it with certain mineral toothpaste and things that, you know, humans put on their teeth. But I do have trace minerals in here. And then peppermint is naturally antimicrobial, but obviously breath freshening. And then myrrh has been used in centuries for oral care and dental care for its antimicrobial and anti-inflammatory benefits, but it's also shown to help shrink tumors and have some anti-tumoral properties like frankincense and, you know, myrrh does as well. So anyway, that's my formula, but
we will put your website in the thread on when we put this video up for sure.
Thank you.
I just wanted to add as well that the mention of a 15-year-old dog, that it sounds like the owner feels that the dog is in pain, that I would not automatically jump to the conclusion that because the dog is 15, you know, a proper dental procedure is out of the question. I would absolutely speak to your vet about it. And if your vet is not quite sure that they feel comfortable putting this dog under, do speak to a vet that has dentistry as their specialty, because they may feel differently about it.
Thank you, Lisa, for saying that. I 100% concur. And there are a lot of pets, because I didn't want to discount, you know, if there are some pets that truly be, you know, experts, you know, dentists or anesthesiologists feel that the risk is too high. But in the majority of cases, it's the pet parent that thinks that, and an expert or a specialist may say, no, with these, you know, with these procedures that we can do and these types of anesthetic that we can use with all of the, you know, safety precautions we can take, you know, we expect this procedure to go very well and for the outcome to be such a benefit to your pet's health that, yeah, I would seek out the resource to really check if that's doable.
Your products, can they be shipped here, do you know?
Yes, they can. So yeah, and we've got, you know, people over there, even Clayton with Pet Business Disruptors is helping us get distribution over there. So we're working on that right now, and it can definitely be shipped. So that's the great thing about homeopathics. There's no food ingredients or, you know, meat ingredients or anything like that. So they're very easy to go cross countries, etc.
Okay, so we have one final question I'm going to ask you, which you must get asked this 100 times a day. See, you're just going to have a bang straight. I know the answer. What is the best chew for a dog? This is from Ruth.
Yeah, so I love that came up, because I was like, oh, we really should talk about this. So thank you, Ruth. What I can say to lead into that answer is what's not good. What's not good is things that are so hard that they are high risk of breaking or damaging the tooth. And so I will tell you that some of the biggest culprits for tooth fracture is antlers and hooves. So those are tremendously hard objects. And at least over here in the United States, antlers are sold at a lot of the retail pet stores. So a lot of people don't know, but veterinary dentists will tell you that's the number one thing that they see break teeth, and hooves too. So what veterinary dentists will say is, as a standard guideline, is that if the object has no give whatsoever, that you can't even slightly bend it with your own hands or dent it with a fingernail, it's hard enough to break a tooth, okay? But things that are longer and thin, like a nylon bone, because nylon bones are too hard too, by the way, the standard like nylon bones or whatever, but things that are long and thin, like a nylon bone or an antler, are statistically even more likely to break a tooth than a hard object that's big, like a big old knuckle bone or something like that. And the reason is because when they're chewing, which is typically the cheek teeth, you know, the front teeth, they might break on like a kennel or a cage bar or something like that. But usually if they're breaking anything chewing, it's the back, you know, premolars and molars, the cheek teeth. And so if there's a large bone that they're just kind of gnawing on, typically there's not enough force coming from the jaw because it's space occupying so much. When there's something that's smaller and thinner, their jaw is so strong that when they come down on it, the strength of their jaw, if that object is harder than the enamel's got to give, you know, it's a pressure war. And so that's the thing there. So larger things that are really hard could break a teeth, but less likely to. So, you know, a little bit of a risk, but not as high of a risk. Rarely see problems with things like bully sticks and stuff like that, but that's much less common to cause an issue. And then to speak more directly to the question, what is great things to give? Um, raw meaty bones, one of the best things if the pet, can do raw diet and is raw fed. Especially traditional things that are common things, I should say, that are used, like the chicken necks and turkey necks, those cartilage bones, things that are very easy for them to get through. It's not too hard. It's not going to cause a problem. But there's that meat or that soft tissue on the outside that they got to get through. That's going to create that nice little bit of abrasive, rubbing up on the gums and the gum line. So, because I love to tell everybody is kibble doesn't do anything, of course, other than promote more dental disease, because it's high in starch, it's heavily processed, and it's not rubbing on the gums. Yeah. And dogs don't even chew those little kibble. I mean, they just swallow them, most of them whole. So something that they can really sink their teeth into, in the wild, and they've got to get into that carcass and really, there's a lot more abrasive. And then obviously anything fresh or raw food has natural enzymes, and it's not promoting a lot of those same bacteria. So, and then one final thing I'll say is there are other good chew items that are either made with heavy, BPA free, rubber materials that are safe, that you can stuff or line, with ridges, and you can stuff little air dried or freeze dried treats or, other foods or whatever. And then they're gnawing on it, and it's, rubbing on the gums and such for, some active biofilm mechanical removal, which is nice. So.
Brilliant. Well, we're at time.
We are. Thank you. So Caroline's laughing because I'm always the timekeeper, and there's always more we want to say and more we want to ask, but we are out of time. Thank you so much for joining us.
Absolutely. Hopefully we got to most of the questions. They were all good. Thank you for both of you for your wonderful interjections that were also brilliant, and I think really rounded out the conversation to be really useful for everybody. So thank you so much. My pleasure to be here with you.
Thank you. An hour flies by when you're in good company, doesn't it?
Absolutely.
We would love to.
Well said.
We would love to have you back one day, but for now, thank you very much.